Hey there. If you've just had oral surgery, don't worry, I've got you covered. In this video, I'll walk you through exactly what to do to heal quickly, avoid pain, and prevent dry socket. Trust me, you don't want that. So let's get into it. First things first, take it easy. No heavy lifting, no intense workouts, just rest. Your body is working hard to heal, so give it a break. A day on the couch? Doctor's orders. Now, let's talk about bleeding. By the time you get home, the bleeding should have stopped. It's normal to have some, but here's what to do. You can change the gauze after 30 minutes, but wash your hands first. Bite down on gauze for an hour. Expect to see a little bit of blood in the sink when you rinse later. That's normal. Now, this is very important. Never sleep with gauze in your mouth. You could choke on it, so make sure to remove it before lying down. Pain? Totally normal. But here's how to stay ahead of it. If you were prescribed pain meds, take them before the numbness wears off. Follow your pain management protocol form. Yes, it's important. Never take pain medication on an empty stomach. Eat something soft first to avoid nausea. Swelling? No problem. Here's your game plan. Use an ice pack for 3 to 6 hours on the day of surgery. 20 minutes on, 20 minutes off. After 24 hours, switch to warm compress. Again, 20 minutes on, 20 minutes off for 3 to 6 hours. You got this. Now let's talk about keeping your mouth clean while it heals. Brushing? Yes. But be super careful around the extraction site. Rinsing? Start rinsing with warm salt water as soon as you get home. Here's how. Mix 1 teaspoon of salt with half a cup of warm water. Instead of swishing and spitting, tilt your head so the salt water covers the extraction site, hold for a minute, and then let it drool out. No vigorous swishing, no spitting. Tomorrow morning, you'll start using your medicated rinse. Fill the cap to the line found inside the cap. Take half the liquid, hold it for a minute, then drool. Repeat with the other half. Use the medicated rinse twice a day for 2 weeks. Once in the morning and once before going to bed at night. Saltwater rinses? Do it as often as you can, especially after a meal. You can keep doing them for longer than 2 weeks to help with healing. Now, what can you eat? Good news, you don't have to stick to just liquids. Soft foods like mashed potatoes, yogurt, eggs, and smoothies are perfect. Just use a spoon for the smoothie instead of a straw. Avoid hard, crunchy, or chewy foods. No chips, nuts, or chewy candy. And remember, stay hydrated. And hold off on straws for now. I'll explain why in a second. One of the biggest mistakes? Smoking or using straws. Both can cause something called dry socket, which is super painful and slows healing. So, for the next few days, no straws, no spitting or vigorous swishing, and no smoking. This also includes vaping and e-cigarettes. If you experience excessive bleeding that won't stop, severe pain that isn't improving, or anything that just doesn't feel right, call your dentist ASAP. It's always better to check in than to tough it out. And that's it. Follow these simple steps and you'll be back to normal in no time. Hit that like button if this was helpful. Subscribe for more dental tips. Stay healthy and I'll see you in the next video. Bye for now.